today we're going to be demonstrating dressing your resident with an affected arm. It will be for the upper body only. So let's go ahead and get started.
Come in.
Hi, Mr. Smith. How are you today?
I'm doing great.
Wonderful. My name is Melissa. I'm going to be your CNA today. I'm just understanding that we need to get that shirt changed for you.
Yeah, that would be great if you could help me change it.
Wonderful. We'll get that done. How's your day been so far?
Well, it was good until I spilled on my shirt.
You know, that seems to always happen when you don't want it to happen.
Yeah, it just was a good breakfast I was eating really fast.
What did you have this morning?
They had pancakes and bacon.
Oh, those are always a favorite, pancake day. Okay, Mr. Smith, I have a couple options here for you. Would you care for your blue shirt or your white t-shirt?
I'll take the blue shirt.
Okay. It's always important to remember to give your resident options. I'm going to go ahead and get that call light. We're just going to put it over here for just a second, get that back to you. It's important when you have a resident with affected arm, just know when you go in for your skills test and this resident probably has had a stroke, they will be identified with red tape. So that is the affected arm, which can also be called the involved arm or the weaker side. Just don't call it the bad arm. So I kind of have a little scenario I like to do so you can remember which side, because it is important to know which side to undress and which side to dress. When you're undressing a resident, we're always going to undress the strong side. Now I kind of give a beach scenario and say when we go to the beach, those wonderful individuals with muscles, do we want to see their clothes on or off? So off, usually we want people to uncover, so we always uncover that strong side. Then I always say when you have those individuals that probably are wearing those bikinis that probably shouldn't be wearing those bikinis, do you want to see them cover up or undress? Do you want to see them cover up? So we'll dress the weaker side. Another thing I'll do, once your resident has chosen what they want to wear, I go ahead and I put that shirt that they've chosen over on that weaker side, so that way I don't get mixed up. It's also important to remember this, you can have your resident sit up to their comfort to sitting up. Just know that some residents, I always try to sit them up if I can. However, some residents you may have to dress in that supine position. Okay, Mr. Smith, we're going to go ahead and we're going to get started. It's always important for you to remember, keep their blankets up so that way we can keep them warm and keep them modest and comfortable. This generation we're serving is a very modest generation. So, Mr. Smith, are you going to take part in bingo later on today?
I'm pretty tired today. I don't know.
Oh, really? Well, you might think about it because my understanding is Walmart donated I'm going to take this over your head. Walmart donated a $25 gift card for your bingo today.
They did?
Yes. I'm never that lucky.
Well, maybe I will play today. I gotta get some more snacks at Walmart.
Walmart's always a great place to pretty much get everything that you need.
Yes, it is.
Make sure to fold this in. It is dirty. Put it in your hamper. If the shirt was visibly soiled, if they just want to change your clothes and it's not visibly soiled, then you can just continue with the gloves that you have on. However, if that shirt is soiled or there's anything going on, open sore or whatever, you do need to change your gloves and do some hand hygiene before you introduce the clean shirt. Okay, again, we're going to go. This is the affected side, so we're going to address the affected side first. And what I like to do is I like to kind of go from the bottom, hold their hand, and just pull that shirt up. Okay, Mr. Smith, I'm going to go ahead. On the count of three, we're going to sit up for a second. 1, 2, 3. There we go. Get that shirt around. Make sure you're getting all those wrinkles out at the same time when you're doing this. Mr. Smith, there we go. Mr. Smith, do you want that top buttoned?
Yeah, that'll be fine.
Okay. Make sure to ask because increased girth of the neck and everything as we get older. Just make sure to ask if they want that top buttoned on your resident. And yes, you do need to button all your buttons. I also ask when I get to the bottom if they want that bottom button buttoned. It's not unusual for your resident to have multiple layers of clothing. So you may be putting on a t-shirt and be putting on a dress shirt. If you do the t-shirt, you'll put one arm on first, go over the head, and then put the other arm in. If you were going to put a gown on and changing that, they're open in the back, and then you would just put that on, pretty much each side on. When you go around, you want to leave room for that individuals to be coming in, help with brief changes or anything else. Just make sure when you tie the tie at the top of the neck, tie it to the side and not to the back. That way it's not laying on one of those pressure points, because you kind of have this little hump there on the back of your neck. Did you want that bottom button?
No, I'm okay with it.
Okay. Make sure it's all nice and straightened out, not bunched up and wrinkled. Mr. Smith. Okay. Covers that. And a task. Okay, Mr. Smith. Here is your call light. And here is your water, right there. Is there anything else that I can do for you? Are you comfortable how you're positioned?
Yeah, I'm comfortable.
Okay, is there anything else that I can do for you while I'm here?
No, that will be all. Thanks for telling me about bingo.
No problem. Well, let me know if you want me to help take you down there, okay?
Okay, I will.
Okay, there you go. Just push your call light if you need anything. See you later, Mr. Smith.